This episode of Healthwise needs no introduction. We have once again the prominent and most informative OB/GYN here in Cebu, Dr. Mila Chan, and our topic will be as revealing as all the others, sex after 50 and beyond. We often assume that people at that age are not sexually active anymore, and people, especially women at that age, believe that they should not feel sexual anymore, and they are often ashamed to discuss sex with anyone, not even their doctor. Well, this show is dedicated to those women out there and for everyone who want to be enlightened. Watch the show and know more from our guests, especially our surprise guest from Oh No, It's Johnny, none other than Johnny Litton himself.
Hello, Dr. Mila. Welcome again to the show.
Here we are again, Mayan.
And then, my partner here, DJ.
Hello.
Second time we're together.
Yes.
And
this is the second time.
we already have discussed about premarital sex, safe sex, and then how often do you have sex? But we have never discussed or even looked into sex after 50 for women, right?
Okay.
So maybe that's...
I'm willing to admit I'm after 50.
So maybe that's the topic that we must tackle
Address.
now.
Okay. I'm game.
And do you have patients beyond 50 who are very much interested in this subject?
Of
And,
course.
it's nothing...
It's not abnormal.
Unusual?
No, it's not abnormal. You could always look at Elizabeth Taylor and her 8th husband,
But
Senator
she's
Warner.
not
but she's
the
showbiz,
usual.
so she's different. But the problem, or if you're willing to talk about it with your patients, they'll talk about it with you. Nobody is willing to open it up or admit they're having sex, and you might get shocked. For instance, I had this one patient that I was going to do vaginal hysterectomy on. So I was telling my resident, when you're going to do a repair, you would like to make it as tight as you can so it doesn't recur. On the other hand, you have to find out if she needs it to remain functional in terms of sex.
Why?
So,
Why? Otherwise, you won't do the repair anymore.
well, you will do it, but you can adjust to the needs. So I tell my resident, okay, you have to ask your patient if she's still sexually active. And then she looked at me and said, oh, come on, doc, you think they still do it at that age?
How old is she?
She's like 76.
Oh,
Then
yeah,
I said,
true.
if you don't ask, you don't know. And you have to ask in such a way that you're sensitive enough that the patient will not get embarrassed. So she said, how do you ask, doc? I said, well, you don't ask, nag-sex ka pa ba? The way you are saying, nag-sex pa ka, You don't say it that way. You say, does it hurt when you have sex? Then that means you are accepting that she's supposed to be having sex. And if you don't ask, you don't get an answer. And when I deal with patients of this age group, sometimes they're saying headache, stomach ache, nervousness, inability to sleep. And sometimes you're surprised when you say, how's your sex life? They won't open it up, and then they begin to cry.
So for women above 50 or above 60, they really have a sex life.
Oh, DJ. Of course they do.
Because I think the common misconception that we have is as couples grow older, they evolve into just companionship.
Friends.
Just friends, and the passion is not there anymore. So it's true
Brother
that...
and sister na lang.
Oh, brother and sister.
Well, actually, it's a question of having an interested and able sexual partner. Because women usually have sex in the context of love, right?
True.
It's not just a biological function.
True.
So if you are in love with the person you are with and he's still able to have sex, of course you will be able to have sex. It's very passive in terms of a woman.
With us women, because we love our men, it doesn't really matter with us. It really doesn't matter.
So I said,
So in terms of
So-
the desire is there.
Yes,
well,
for
depends on your
for
interested
women,
and able sexual partner.
yeah, for women, yes.
Yes.
It's just
Yeah.
that we suppress it and
Yes.
we don't
You
think
don't go
about
out
it.
looking for it.
Yeah.
So at what particular time does it decline or it never declines?
Well, after the menopause, there is some degree of decline, but in some women it increases because actually, the sexual drive is related to testosterone. And when women reach the menopause,